Hi, Dr. Knostman. Good afternoon. My name is Esha, and I am a high school student interested in being a veterinarian. I'm so excited to welcome you to the interview series on the careers of veterinarians. Thank you so much for joining us. Let me start with an introduction of our speaker. Dr. Katie Knostman is a veterinary anatomic pathologist living in Columbus, Ohio. She started her career path at a College of Veterinary Medicine at The Ohio State University and began working as a veterinarian in a busy small animal hospital after graduation. Deciding to move behind the scenes and focus on pathology, she returned to The Ohio State University to complete a veterinary atomic pathology residency and a molecular biology Ph.D., where she developed a particular interest in mouse models of disease. During her 15 years working for contract research organizations, she interpreted pathological findings from several hundred studies involving pharmaceuticals, nutritional supplements, medical devices, environmental contaminants, and infectious diseases. She has also evaluated surgical biopsies from pets as a consultant for 13 years. She is currently the sole pathologist at a genetic therapies biotechnology company working to find cures for serious childhood diseases. Dr. Knostman has three sons, a dog named Betty, a cat named Juno, and lots of fish. In her spare time, she likes to hike, read, watch movies, listen to podcasts, watch sporting events, and gardening. Thanks again for chatting with me today. Could you tell us about the type of work that you do? Feel free to screen share and show any pictures or slides that you want.
Sure. Hello, and thanks so much for having me today, Esha. I'm happy to talk about kind of an alternative veterinary career with your pre-vet group. And just as a brief disclaimer, these are all just my own personal opinions and experiences, so I don't want to present them as opinions of my employer or previous employers or universities. Okay, let's start with a little definition of what exactly a veterinary pathologist is. So, a veterinary pathologist is a veterinarian who got some special advanced training in pathology. And pathology is the study of diseases, especially the structural and functional changes that are caused by them. So, after completing vet school, a pathology residency of at least 3 years is generally completed. There are two subspecialties of pathology, anatomic and clinical. And it's pretty rare for a pathologist to be dual boarded in both of them, but it does happen. I'm an anatomic pathologist, so what I do is study the morphologic changes in organs and tissues. Clinical pathologists, on the other hand, would study changes in blood, urine, and other body fluids, or they would look at needle aspirates of small numbers of cells smeared on a slide. So clinical pathologists often work with specimens from live animals. Anatomic pathologists like me, we may work with biopsies from live animals or with some specimens that were collected at necropsy. A necropsy is just the animal equivalent of an autopsy. So my presentation today will be mostly focused on anatomic pathology. The photos that are on the slide show a histiocytoma. That's a common tumor in young dogs. And so up at the top, we have more of a fine needle aspirate or a cytologic smear. So this would be something that a veterinarian in a clinic would have collected by drawing out some cells with a needle and putting them on the slides, looking at them. And so that's more of a clinical pathology process. At the bottom, this is a biopsy of the tumor. So you can tell that it's, you're kind of looking at different things. In anatomic pathology, you are looking at sort of a pattern recognition. And then clinical pathology, when you're looking at these fine needle aspirates, you really have to be good at knowing sort of the nuances and the details of the nuclear and cytoplasmic features. So at the end of a pathology residency, there is basically a multi-day board examination. In more recent years, it's been split into several parts. So one of them is taken earlier. A veterinary pathologist might also get a research degree like a PhD or an MS. I got a PhD as part of a combined program. So that was pathology training and also scientific research towards the PhD. Let's spend just a few minutes talking about the process of histopathology since it's such an important part of veterinary anatomic pathology. So basically, how do we do it? Let's begin with a diagnostic example because it's the easiest to understand. So a lesion is seen on a pet, often by the owner, and then taken to their regular veterinarian. And maybe this lesion is a lump or mass, so you can tell that we've got a lump on this dog. So if the lesion is a lump or a bump, a few different things might happen. The veterinarian might collect a fine needle aspirate, like we previously mentioned, smear that on a slide and either examine it themselves in the clinic or submit it to a clinical pathologist for a diagnosis. It's not always possible to get a definitive diagnosis from a fine needle aspirate, but it often does provide information that helps to kind of make a decision about if and how to remove the lump. So the lump can be removed entirely at surgery, or a punch biopsy can be taken from the awake animal after numbing the area. So this is actually more like a punch biopsy. It's a little tool that just takes out this little punch of skin. If it's a tiny mass, it may take out the whole thing. If it's a big mass, it'll just be a little representative area. So then the next step is going to be that the tissue removed from the animal is placed into a fixative. Often that's formalin or a formaldehyde solution, and that prevents the tissue from autolyzing or breaking down. Autolysis begins quickly and it can interfere with making a diagnosis from the biopsy. So this fixation step is very important. And the way that formalin fixation works is it binds to amino acids that are part of the proteins in the tissue from the animal, and it cross-links them. And that way enzymes can't digest the tissue. And if there are any bacteria in the tissue, they're killed. So the tissue also becomes more rigid in this process. So now we've got fixed tissue and it is ready to be trimmed and oriented into a wax mold. And this step and the following ones are often done by histotechnologists. And I like to mention that histotechnology is a great career for someone who enjoys science and lab work, but maybe doesn't want to stay in college for so many years. And the training involves an associate's degree and passing a certification examination. So histotechnologists are great. Here we can see at the top photo, a histotechnologist is putting the tissue into like a melted wax into a little mold. And then after that, it will be in a nice firmed up mold, tissues properly oriented, and it's attached to a cassette for the next step. So now that we've got the wax mold, it's rigid and it keeps the tissue in whatever orientation we wanted to look at under the slide. This block is now attached to a microtome, which we've got a picture up here on the top. And the microtome has a sharp blade and a rotating wheel, and it can cut very thin sections, often only 4 or 5 microns. And then one or more of the thin sections is floated in a water bath and attached to the glass slides. So at this point, most busy labs will use an automatic tissue processor to move multiple slides through this process of removing the wax, rehydrating the tissue, and then staining it with a histologic stain that makes the tissue structure visible under the microscope. Often we use hematoxylin and eosin, it's shortened to H&E, and that gives kind of the classic pink and blue appearance to the stain sections. There are other stains that can be used if we want to highlight something in particular, like organisms, collagen, fat, mineral, etc. But H&E is a good all-purpose stain. So here at the bottom, this is an unstained slide. This is how it looks before it goes through the processor and is stained. Now we're to the point where someone like me comes in. So a pathologist will look at the tissue using a bright field microscope, usually kind of a nice binocular one with some good quality objectives of different magnifications. And then using their knowledge of normal anatomy and histology in that species and the appearance of tissues with various diseases, the pathologist will make a diagnosis and write a brief report of the findings. And so we call that process histopathology. Now, since we're in a diagnostic setting, the veterinarian, who may be the same one that removed the lump at surgery, will receive the pathology report and discuss it with the pet owner. Sometimes no further treatment is needed, while other times the biopsy results are used to design a treatment plan. So let's take a quick look at a few biopsies from my diagnostic collection. So at the top left, a dark mass was removed from a dog, and microscopically, it's a hemangioma. That's a benign tumor that is made of blood vessels. And so no further treatment is needed in this animal. At the top right, a puppy was ill and had signs of liver disease. So a liver biopsy was taken at surgery. And microscopically, this liver is full of macrophages, which are a type of immune cell, and they contain histoplasma yeasts. That's what these little dots are. Histoplasmosis is a non-contagious disease between animals, but it's caused by a fungus that's in the soil, bird and bat droppings, and it's most common in the Ohio and Mississippi River valleys, and it can be treated with antifungal drugs. So that's something that I do see here occasionally in Ohio. At the bottom left, this is skin from a dog that had hair loss and a very brittle hair coat. So a skin biopsy showed that the hair follicles are stuffed with these Demodex mites. This is a type of mange. So this condition can be treated, although sometimes it's difficult to cure in advanced cases. And then finally here on the lower right, a horse developed a mass on its third eyelid, which is kind of the little internal corner of the eye. And microscopically, this was a tumor called a squamous cell carcinoma. And that's a kind of skin cancer that can be caused by long-term sunlight exposure, especially on pale areas of the skin. How about veterinary pathology in a research setting, which is where I do most of my work? So research settings include pharmaceutical companies and contract research organizations, which run a lot of highly regulated studies sponsored by drug companies and government agencies and universities, especially when those sponsors aren't set up to do it themselves. So animals are often used to test the safety and the efficacy of potential new drugs and medical devices that are intended for humans. Most research studies are using mice and rats, although some larger animals may be used, especially when they're a better model for the disease or the drug being tested. Monkeys are very limited in availability, and they also obviously raise more animal welfare concerns, but they are used in low numbers in some situations where they're the only species that can recreate a human response to a drug. Most animals in research studies are a normal, healthy breed or strain of animal, but disease models can be used, sometimes mice, that's the case. So there's a long-term push to reduce the use of animals in research, and there are in vitro methods and computer models that are commonly used, especially in early research. There's currently not a non-animal model that fully recreates the complex systems of animals, but in vitro models are like organ chips and things are increasingly being used. When animals are used in a research study, most of the time the goal is to treat them with a test substance like a potential new drug and have them survive to a scheduled euthanasia point, often weeks to months or sometimes years. After euthanasia, their carcass is closely examined. That's part of necropsy. And then tissues are collected and fixed and processed similarly to the method that we talked about with surgical biopsies. Really, the main difference is that lots of organs and tissues are processed from each animal. The sections are very consistent between animals, and pathologic findings in the treated groups are compared to a matched control group. The control group's generally untreated, or it's treated with just an inert vehicle. So instead of focusing on the individual animal like we do in surgical pathology, we tend to look at the incidence and severity of pathologic findings across treatment groups and doses when we're in a research setting. So a pathology report is written and it will describe the treatment related findings, and then the pathologist and other scientists working on the study will work together to try to explain the mechanism or the reason that there were changes. The broader scientific team will also try to determine how relevant those tissue changes might be to humans. So creating a new drug, testing it, and getting it approved for use in humans is a 5-step process that takes many years. Most of the animal research happens here in steps 1 and 2, where I have the stars. These are discovery and safety testing. So permission must be granted by the FDA before a drug that looks promising in animal studies can be tested in humans. IND, or investigational new drug application, is the point at which permission for human clinical trials is sought. And there are some standards, strict standards actually, for the conduct of the important preclinical research, like good laboratory practices. Some of you may have heard of good laboratory practices, or GLP. Additionally, or occasionally, information from human clinical trials will lead to additional animal studies. For example, I worked with a potential new drug that caused an electrolyte change in a few humans that were in the clinical trials. So we had not seen this before in earlier animal studies. So we performed a few more studies to collect tissues for some special analyses. So sometimes you can circle back and do some more animal studies even after you've got human clinical trials going on. Let's look at a few lab animal specimens. Here at the top left is the nasal cavity of a rat. So it's kind of cool to see all the scrolls of the nasal passages. And then this globby material that's in the airway is basically dead fungus, actually, when you look at it at high magnification, because this was a study that was testing the safety of a mushroom origin food supplement. The supplement was pretty thick, and so some rats regurgitated a little bit up into the nose, and it didn't cause any problems, but it looked pretty interesting. This top center photo shows the liver of a mouse from a NASH or non-alcoholic steatohepatitis mouse model. So NASH is a common disease in humans where fat builds up in the liver and it causes some inflammation and fibrosis. You can see the fat in this mouse liver. That's what these clear droplets are. Here in the top right, this is the subcutis, or the area just beneath the skin of a rabbit, and it's been injected with a graft of fat and some fibroblasts. So this is a treatment that could be used cosmetically or to help heal humans after injuries to their skin. This graft is pretty inert. It's not causing any tissue damage, so you can just see it kind of filling in the area. So there are a couple of cool things here at the bottom as well. This lower left photo, this is a kind of a close-up of the brain of a mouse model of Alzheimer's disease. So these three arrows are pointing to dark pink plaques, if you can appreciate them, just kind of little stellate-shaped plaques. These are clusters of beta amyloid, and it accumulates in the brain and interferes with nervous function. This lower right photo is the kidney of a rat. It's pretty high magnification, kind of the outer edge of the kidney. And this rat has been treated with high-dose oligonucleotides. So it's a kind of genetic therapy that can work by binding with messenger RNA and target cells and affecting how that's spliced or translated into a protein. So even if the kidney is not the intended target of the oligonucleotides, they do accumulate there as part of their excretion from the body. And so you can actually see them as these things we call basophilic granules. They're pretty bright in here, just sort of accumulating in the tubular epithelial cells before they're cleared from the body. So that is a pretty somewhat in detail overview of what I do as a veterinarian, both in sort of a diagnostic and a research setting. So now that we've covered the basics of veterinary pathology in a diagnostic and research setting, let's just look at a sort of a typical work day or a day in the life for somebody like me. So a day in the life of a veterinary pathologist in a pharmaceutical company, there are a number of different things that I might do. I provide a lot of input into the design of new studies. So kind of what is the ideal pathology phase and specimens to collect. I may supervise necropsy. There are technicians that are definitely trained to do that, and so they can cover a lot of things, but they often consult with me if they see something unusual or they want some advice on how to record it in the data. I read slides from studies where the in-life phase is complete. And so since we want to be able to get like an incidence of changes and severity of changes across groups, because we're looking at mainly groups instead of individual animals, we often use a severity scale. So like 0 to 4, 0 to 5, kind of either findings absent, minimal, mild, moderate, marked, severe. Once all the data is collected, I write pathology contributing scientist reports, and then they will go into the overall study toxicology report. The purpose of my report is really to interpret findings that are treatment related versus background changes in a species, and also try to identify what's the mechanism of those changes. How is this drug causing it? I can also help to interpret some findings from clinical trials. So even though clinical trials are involving humans, there's obviously a lot of translational work that I actually can give some input into. I do participate in some method development for molecular and digital pathology techniques. So that might be collecting some frozen sections and labeling them with antibodies to certain proteins in them, immunofluorescence, immunohistochemistry. I do work with the lab animal veterinarian on colony issues. So if we're trying to make sure the colony is healthy, or a mouse or a rat seems to have some kind of unusual issue, I can help give input there. So I should mention that lab animal medicine is also a veterinary career option. There are veterinarians working in research who are not just pathologists. As a veterinary pathologist, the job is, it has very regular business hours, which is pretty appealing, and it's got good pay. You're rarely on call, so that is kind of a bonus. And I would say the biggest surprise for me as a veterinary pathologist in research is that I spend a lot of time writing. I write tons of reports, and I always pictured myself as reading slides and collecting data, but it didn't really register to me exactly how much time I would spend writing. So I've gotten pretty good at scientific writing. Oh, actually, I want to go back for just a second just to point out that this picture here, this is also a kidney, really high magnification, and this is a glomerulus that is the part of the kidney that's filtering the blood, and it has these big clear spaces in it, and that is because this was actually an animal where it was getting a test article or drug that was in kind of an oily base, and a little bit of the oil got into circulation, and so there's a little bit of oil in the kidney. I called this slide an evening in the life of a consulting diagnostic veterinary pathologist because this has only been something that I've ever done kind of on my own time, outside of my regular job. So it's always been in the evening. So the way that this works is that flats of biopsy slides are delivered by a courier, or they could be FedExed. They come with submission paperwork from the referring veterinarian. So what did they see? What kind of animal is it? How old, et cetera. I would say in my 13 years of doing diagnostic veterinary pathology, for some reason, 70% of what I get is from dogs. Like a lot of dogs receive biopsies. Probably 20% are cats, 5% are horses, and then there's a few other things. And obviously, what I get submissions from the most would be skin, followed by oral cavity, and that's because that's where you can see as a pet owner that something is going wrong. The biopsies that come from internal organs are more like, maybe something came up in routine blood work and there was an ultrasound and some kind of mass was found, or some kind of abnormality in the liver or something like that resulted in a biopsy. But those are fewer than just the things that we see on the surface of our pets. So each report in a diagnostic setting has a lot of flexibility for pathologist interpretations and recommendations. We're really looking at the individual animal. We're not really doing kind of a comparison across groups or herds or something in general. The critical piece for surgical pathology is that the timing is super important. So the slides will arrive in the evening and the reports need to go out the next morning because someone is waiting for this information to make a treatment plan. The pay is somewhat modest as compared to research. It's since I just have done this on the side as a consultant, I've just been paid by the case, and I would say the biggest surprise is that it's really fun, it's interesting, and also I would say like 90% of the cases have an obvious diagnosis for me, at least after having done this for a while, and then like 10% are weird, and I have books out and I might show them to someone else, and or I have an idea that it's one of two different things and I'm trying to kind of go down the decision tree there. This image that is on the slide is showing the surface of dog skin. It's kind of abnormal, it's thickened, it's totally inflamed, and then these kind of yellowish things in there, that's part of a plant material like a thorn. So here I have a year in the life of a vet school admissions reviewer because I only do this, once a year when the review cycle comes up. So normally in the fall, I'll get some refresher training, not too much changes from year to year. And then in November, I will do as many file reviews as I can handle, like maybe 25 or 30. Typically, the academic achievement part gets its own separate score. And so what I'm looking at in the file review is more like essays, letters of recommendation, and all kinds of experience and awards and things like that. And the potential to add diversity to the field. And then normally about a month later in December, I'll get refresher training for the admissions interviews. Because if you think about it, the file reviews happen and some people get offered an interview. And so the interview is the next step. And so in January and February, I'll be assigned some admissions interviews, as many as I said that I could handle. And they'll be different candidates than the ones that I did the file review on, because they obviously, the vet school would like different sets of eyes and opinions. So when someone is interviewing for vet school, typically two people are interviewing. Occasionally, two people are interviewing the candidate, the applicant. Sometimes there's a third person if that person is shadowing and learning how to be an interviewer. And of the people that are interviewing the candidate, at least one needs to be a veterinarian. Sometimes both are. Sometimes one of them will be like another staff member or faculty member from the university, or a current veterinary student that is selected to do it. So there's definitely one veterinarian, but the other position varies. Usually this was held in person and be part of kind of programming that the university would do. Ever since COVID, these have been virtual, so they've been Zoom based, and they haven't gone back to being in person yet, but it's pretty smooth. And I would say that my biggest surprise in admissions interviewing is that sometimes, pretty often actually, I will read a letter of recommendation where the letter writer will mention just something super cool that the applicant has been involved in. And it's usually a non-veterinary thing, like, oh, they have this other skill set that's very cool. And it will be something that the applicant didn't put in their application. So I think sometimes people are filling out the application and they're just laser focused on, the veterinary shadowing and things that they did, and they don't necessarily think to put some of the non-veterinary things, whether it's jobs, clubs, being a musician, whatever it is, that they're sort of things that make them look like a well-rounded person. Sometimes they just forget to put that in there because they're so focused on the one thing. So what was it like for me when I was a practicing veterinarian? So this picture of me, I'm actually in the barn. I'm a vet student here, so I'm a senior vet student in this picture. But I did go into practice, which I'll touch on a little bit later, and right after vet school. And I was full time in practice for a year, and then I did weekends for a while after that. So when I was in practice, I did usually about 3.5 days a week, so like 3 full days, and then a half day on Saturday. I would be seeing appointments, and so they would be every 15 or 20 minutes. I would have a big lunch in the middle of them because sometimes the morning appointments run over. You try to squeeze something in to the lunchtime, and so you want to make sure you have enough time. So the schedules varied based on preferences and seniority. The hospital would be open, say 8 a.m. to 7 p.m., but the same person wouldn't be working that whole time. Somebody might be on the earlier shift. I kind of liked at that age being on the later shift. So sometimes I was like 11 to 8 or something like that. So it was definitely flexible and negotiable since I was part of a team of several veterinarians. I was on call one night per week. And I think increasingly over the time I was there, we started referring more to the emergency hospital here in the city rather than coming into the clinic alone and seeing an emergency call, although we did do that sometimes. So most of the appointments that I saw were healthy pets, physical examinations, vaccinations, and then a few cases per day would be sick. And then occasionally, like 1 or 2 per week, would be sick enough to be hospitalized and maybe put on fluids or something. We did have veterinary technicians there. They were super skilled. Probably a lot of you know that vet techs can be way better than veterinarians at some of the hands-on stuff like the blood draws and things. So they were amazing. I say I was assisted by my favorite books because I used to keep a book like outside of the exam room, kind of back where we would prep medicines, like a reference book. Since just keep in mind this was like the internet was a little bit smaller then, so nowadays you could easily just Google something or whatever, but or look at an ebook. But I like to refer to some things sometimes when I was early in my career and I was trying to make some decisions on what to prescribe, etc. I used to do surgery 1 day per week. So there were the 3.5 days that were seeing patients, and then 1 day per week was strictly surgery. And this was actually set up very well for me. We had a surgery suite that had 2 tables that could be going at once. And so I would have cases on one, and my boss would have cases on the other. And he was a very experienced veterinarian, so he could come over and advise me on things and kind of teach me procedures that I hadn't had a chance to do in vet school. So that was actually a very good arrangement. And then the biggest surprise for me in practice was that there was a lot of time spent talking about finances. So kind of coming up with a recommendation on doing some diagnostics and treatment and an estimate, and then sharing that with the client and trying to see, what could they afford and what they wanted to do with that. And then also just the amount of time generally spent on human interactions, because you think about being a veterinarian, I want to examine and treat animals. And obviously the animals have owners attached to them. And yeah, maybe I mean, if you're like me, you kind of underestimate the amount of the job that is really human interactions. So that's a pretty good summary of what it looks like in the different roles that I have.
Thank you so much for sharing all about your work with us. This is really inspiring, and I've learned a lot. So now I was wondering if you could tell us about your education and training that prepared you for this career, how it helped you, and what were the prerequisites, and where did you study?
Okay, that is a great question. So we can talk about kind of how did I get here to where I am right now. I knew that I wanted a career in life sciences or medicine. I had done a microbiology science project when I was a senior in high school, and I also thought maybe I wanted to be an orthopedic surgeon after my best friend had surgery to correct scoliosis, and I was really interested in that. So when I came to the university, I was pre med. And I was majoring in psychology because it was interesting to me. And I felt it didn't really matter what my undergraduate major was if I planned to go to medical school anyway. And then I started to get more interested in comparative anatomy and comparative physiology, so across species when I was taking biology courses. And I decided by the end of my first year that I'd prefer veterinary medicine to human medicine for this reason. The prerequisites for vet school and med school are basically identical. I just would need some veterinary experience and I would need a letter of recommendation from a veterinarian in order to apply to vet school. And I was like deciding pretty late to do this compared to other people. A lot of people, it's their calling from the time that they're, very small. And so they're ready for it. So what I started doing is I quickly started shadowing once a week at a local veterinary clinic. And I also got hired into the large animal barn at the university veterinary hospital where I moved and fed animals and cleaned stalls. So it was grunt work, but it was really fun. Wasn't glamorous, but I got to see veterinarians and veterinary students in action working in the barn there. So the first veterinarian from the small animal clinic where I was shadowing that I asked for a recommendation, she said that she didn't know me well enough to write one. And that was pretty crushing to me because, I was already deciding late. And I was like, what am I going to do here? Fortunately, another veterinarian from that same clinic kind of had mercy on me and she agreed to let me shadow, get to know me a little bit, and write the letter. So meanwhile, I was on track to graduate from undergraduate with a Bachelor of Science degree early. But if I didn't do anything different, that would happen kind of in the middle of an academic year. And then I would just be waiting around till the next fall to start vet school if I got accepted. So I decided to take a heavier course load and summer courses. So I would do like a full load of summer courses. So that way I was able to graduate with my bachelor's degree a whole year early and I went directly into vet school a year early. I managed to do that. I had just enough credits to get a BS in psychology. And most of my pre-vet requirements were actually considered as electives by my major. So, you're majoring in something and they say like you're doing a bunch of psychology classes and then you have certain other just general educational requirements and then there's space for electives. And I had, kind of funny electives because they were like courses in genetics and biochemistry and microbiology. Um, I think a lot of people who apply to vet school are a little bit more focused on that, and you see like animal science and biology majors more commonly. I actually only applied to one vet school, Ohio State. That's where I'd worked in the barn. That's a pretty cautious choice to only apply to one, but it was rated well, and I didn't feel ready to move away. So I did apply there. Um, and I got accepted there, fortunately. So I entered the College of Veterinary Medicine planning to be a small animal veterinarian or maybe an internal medicine specialist. I did take a couple of pathology electives during my vet school time, mostly because my two friends were taking them. And my friends actually, they both became clinical pathologists. So I found pathology to be interesting, but I got motion sick looking through the microscope at that age. So it was kind of difficult for me. Vet school was basically arranged so that the first 3 years involved coursework and labs, and then the last like year and a half involved clinical rotations. I think most recently the structure's been a little less rigid, so vet students can get clinical experience earlier. For me, the pathology rotation was my very last rotation as a senior before I left for an internship and then graduated. And so I loved it. I thought it was wonderful covering necropsy and learning more definitive answers around why animals had become sick and died. My professor was smart and funny and predicted that I'd be back for a pathology residency, but I insisted I was going into clinical practice. I passed the national board examination, so I became licensed as a veterinarian. And that exam had two parts in those days. One was sort of a book knowledge, multiple choice kind of test, and the other one was called the clinical competency test. And so the clinical competency test presented sort of clinical scenarios like any species, all species, including farm animals. And then you'd pick the next step, like kind of like a choose your own adventure. So, like, what diagnostic would you run? And this is the result of that. So, now what would you do? And so I found that I did really well on the board examination part and I barely passed the clinical competency test. It was really hard for me, especially the non-small animal part. I'm going to skip over my time in clinical practice since we're talking about education here, but I will return to that later. After a few months in practice, I contacted the professor who had taught me pathology during that last clinical rotation, and I told him I was indeed thinking about applying for the anatomic pathology residency. And I learned that if I wanted to do the residency at Ohio State, I would have to enter a combined program, which meant a residency and a PhD that supposedly took about 5 years to complete. I didn't have a super deep passion for doing the doctoral research and the PhD, but I thought it seemed worth it to do the residency there. So I went through a moderately lengthy interview process and I became one of 2 anatomic pathology residents that following year. So being a pathology resident, it did mean that you got a small stipend, like a salary, nothing big, but it's better than zero. I loved learning about pathology, and I overcame motion sickness. So after about a year, I would practice using the microscope, and I would eat ginger, and I would wear C-bands and things, and I finally overcame the motion sickness. During my pathology residency, I thought maybe I wanted to stay in academia at the end of it, maybe be a professor who teaches and covers diagnostic pathology for a university. As I got closer to the end of my residency and PhD, it seemed like there was sort of a culture shift away from those kind of jobs. Everybody wanted research track professors who ran labs or kind of adjunct faculty and instructors to teach. And I thought if I went for a research track faculty job, I would have to apply for research grants. And my experience with writing for major grants when I was a PhD candidate was pretty unsuccessful because they were so competitive. So I was hesitant. So I attended a veterinary pathology conference about a year and a half before graduating from my residency and PhD. And I met a pathologist there who was interested in adding to her team at a contract research organization not far from me. And we kept in touch. And while I hadn't initially planned on becoming a toxicologic pathologist, I kind of liked more of the diagnostic stuff, I accepted that as my first kind of real pathology job. So in the end, it took me more than 6 years to finish that PhD and residency. And part of the reason was that I had 2 children by then, and part of it was that I had a difficult research project that gave me a lot of negative data. So here, this is the title of my dissertation, but I used to joke that I could have named my project, "Here are all the things that do not regulate the sodium iodide symporter in breast and thyroid cancer," because I had so much negative data. I didn't take the pathology board examination until a few months after I finished my PhD, so I was already working my first job by then. My PhD advisor, who had helped to kind of get me out of there finally after 6 years, unfortunately died a few months after I graduated. So I did end up being his last grad student. So that's kind of my educational path.
That was really helpful for someone at my stage to understand what to expect in the future. Could you discuss about how your career evolved over time, including skills and experience you learned during your fascinating journey, the best career decision you made, and any setbacks that turned out to be an advantage, and any considerations as you made different choices during your career?
Sure. Okay, so let's start with career evolution. I mentioned earlier that I was a small animal clinical veterinarian after vet school. I worked full time in the clinic for a year, and then I worked on Saturdays for about 5 more years during my pathology residency. So the small animal clinic was a busy one with a good reputation, and it was located kind of on the edge of an economically diverse suburb. So there were a variety of clients, and sometimes we had to have discussions about treatment plans and finances and that kind of thing. I graduated from vet school on a Friday and I was working as a veterinarian the following Monday. I felt extremely unprepared. I remember that my boss had asked me to participate in an Ask a Vet event at a local festival so people could get to know me, community members could get to know me. And I was scared to death that I wouldn't know the answers to their questions. When I was in practice, my head was kind of swimming with all the potential diagnostic tests and the drug options. And I didn't know what was a reasonable first treatment plan to suggest out of all these plans in my head. So I used to run my test and treatment plans by the more experienced vets sometimes to see if they sounded reasonable and like what they would do as a first step. And I was pretty devastated if cases didn't go well, even if the outcome wasn't really my fault. So I realized within a few months of graduation from vet school that clinical practice didn't suit my personality, which was something I never considered during vet school or even when shadowing vets who were making the treatment decisions. I am introverted in the sense that like a high pace of interactions with lots of people drains me a bit instead of really energizing me. And I also just couldn't stand to make mistakes or just not be in control of outcomes. And that's just a natural part of clinical practice. So it seems kind of obvious to me in hindsight that I should have pursued a more behind the scenes veterinary role from the beginning, but I just wasn't that self aware. And most of my vet school colleagues were going into clinical practice. So I figured that would be a good fit for me as well. So, as I previously mentioned, after a year in clinical practice, I returned to the university for the residency and the Ph.D. program, and then eventually I stopped working in the clinic altogether when I got pretty far along in my residency. So, I'm going to skip forward to having completed my residency and picked up my career again. So when I finished my residency and PhD and I got a job from that connection I had made at a conference, it turned out to be set up really wonderfully for a new pathologist. So my boss was a fantastic mentor, and she had designed on the job training that really stretched across my first few years. So I started out by peer reviewing pathology findings and studies she had read. Then I moved on to small, kind of clean studies, meaning they don't have a lot of pathologic findings. And then as I moved on to more complicated studies, my more experienced colleagues would continue to peer review my work. So I eventually became very proficient at toxicologic pathology after learning from such a smart and experienced team. I would say the best thing about the CRO or contract research organization environment is that I worked on a huge variety of studies, basically whatever a sponsor had contracted us to do. I was the study pathologist for several hundred studies over 10 years that I spent at that first job. The hardest thing about the CRO environment is that the timelines are pretty aggressive, so I read lots of slides daily. I like that I got to be part of a larger corporation that hosted guest speakers and had employee resource groups and fitness opportunities and things like that. Some of the work that I did there, especially if it was sponsored by government agencies, got published. And I left that position with a good amount of confidence in my pathology skills. The reason I left my first pathology job was that someone lured me away to a smaller CRO that was located out of state so I could work from home. The smaller CRO handled a lot of mouse models and kind of niche work that I hadn't seen in my first job. So it ended up not being a lateral move, but some new stuff that I got to do. So about 2 years into that position, the small CRO merged with four other small CROs, and they needed a senior director to manage all the pathologists in the combined company. And that was my first experience managing people, and my team was pretty large. I started out with 28 direct reports until we kind of reorganized into teams, and then I had about 10. And fortunately, my team was experienced and very trustworthy. So my leadership style was just to kind of be available to help with issues, but not to breathe down their necks. And I got a lot more comfortable interacting with senior management, leading meetings, and building new work processes and things like that. And my manager was an excellent mentor in that area. So I stayed there for about 5 years before making a change to a position outside the CRO environment. I'm currently the only pathologist at a medium-sized genetic therapies company, so there may be 1,000 people in the whole company and probably under 200 at my site. This company previously sent all the pathology work to consultants or contract research organizations and is now growing the expertise in-house. It is super different and very challenging. I get to focus really in depth on a few kinds of treatments rather than seeing a wider variety of studies. I get to see molecular data from studies and suggest some new experiments. We also have digital scanners and some artificial intelligence algorithms so we can scan slides and then we can measure various things about the tissues that are on them. I'm on site 3 days per week, which was it felt like a major change after working from home for 5 years. And this is the first job that I didn't get through a connection. I was just browsing around online and it caught my eye. However, it turns out that I do know some people in this company from back from my very first job. So it's kind of a small biotech world in this city. So, what about career lessons learned? I would say, so looking back at 20 plus years since I became a veterinarian, my lessons learned would be that my best career decision was actually leaving clinical practice for pathology. Pathology is always interesting to me. It allows me to work behind the scenes. It's somewhat at my own pace and it's suited for my personality. I would say the setbacks include The first veterinarian I asked for a letter of recommendation for vet school, like I mentioned, turned me down. Just didn't feel like she knew me well enough, and I really needed a recommendation. So I'm grateful that someone else let me get to know her and wrote me a letter. And I try to pay that forward by having written letters of recommendation for a number of coworkers seeking grad school opportunities, and then also, like I mentioned, helping with the admissions file reviews and interviews, since I know what it's like to be in that position. I had a realistic concern that I would be unable to overcome the motion sickness I had while using a microscope, and that I would have to leave the profession. And so I was able to train my brain out of that during my residency as long as I'm the one moving the slide. So there's a thing called a multi-headed microscope in which one person drives, and everybody else looks through their eyepieces. And so I have to look away until somebody settles on a field and says, "What about this?" And it's kind of similar for digital pathology as well. If I'm looking at the screen and someone else is moving the slide, I kind of have to wait until they pause on something. Another setback I would say is that I was initially disappointed that the kind of academic pathologist job I wanted seemed to have become obsolete or pretty rare and hard to get. I didn't expect toxicologic pathology to be very interesting, but here I am 16 years later and I really enjoy the work. Also, my PhD advisory committee would not allow me to take the ACVP board examination until my PhD was complete, because they wanted me to focus primarily on research. And so this was somewhat unusual. Most of the other residents took their ACVP examination while they were still at the university, so they kind of had a network there going to help with exam prep. I was already at my first job, and so I kind of had to negotiate to work part time and study part time, and that was challenging. However, I was pretty motivated to pass the exam because I thought it would be pretty hard at my job to stay unboarded for a long period of time, and I did manage to pass it on the first try, so that was fortunate. Um, I had 4 different managers at my first job, and one of them I felt like was, like, surprisingly promoted over me. I wasn't ready for it, and it left me free to put more experience and energy, or put more energy into kind of getting more research experience. So some of the choices that I faced along the way, I would say one is that I considered preparing for the American Board of Toxicology board examination, and that would make me dual boarded in pathology and toxicology. I bought the most important toxicology textbooks to study for that, and I got like 20 pages into the first one, and I realized I didn't want to become boarded as a toxicologist, even though it's perceived somewhat favorably in my field. And so I still have a tape flag in that huge book at the spot where I stopped. Another choice was children and family. So I mentioned that I had 2 babies during my pathology residency, and then I had a third during my first job. And I think there's no perfect answer as to uh, when you should do that if it's something you're interested in, but I think it's doable, if and when you decide. I'm now far enough along in my career that I mentor more junior pathologists, kind of formally and informally, and I participate in committees and I give educational presentations, and I think that's part of the process. A big question at this point in my career is, where do I go from here? Would I want to be promoted to a more senior management position that didn't allow me to do any pathology work anymore? Many pathologists eventually work as consultants late in their careers. Is that something I would want? I think my whole career path has been appreciating where I am until the right opportunity kind of drops into my lap. So I don't have that all figured out. The most rewarding aspect of my career is that I'm literally always learning new things, and it's very intellectually stimulating. And also, my quality of life is good with reasonable work hours, good pay, and good benefits. I get to be part of a larger team of smart scientists, and I feel like my little niche area of expertise is appreciated. The biggest change I see in the field of veterinary pathology is increasing use of molecular and digital pathology techniques. So, in addition to routine histopathology, just light microscope H&E, the pathologists need to be able to understand and interpret immunohistochemistry and immunofluorescence, which is antibodies that are labeling proteins on the slide, or in situ hybridization, where probes are labeling nucleic acids on the slide. We also need to get comfortable with digitally scan slides and AI software that helps us to measure, size and intensity of various structures on the slide. Veterinary medicine in general, I would say, as veterinary medicine in the US has become more female over the past decades, the field of pathology has also trended that way, although perhaps a little less dramatically. but it means that, female veterinarians and female pathologists like me were often trained at the university and mentored by older male pathologists. And veterinary medicine as a field is working to kind of increase diversity. So there's some initiatives aiming at improving attraction and inclusion of underrepresented identities. When it comes to veterinary clinical practice, I think there's increased emphasis on One Health, so sort of the interconnectedness of animals, humans, environment, et cetera. And while I'm not in clinical practice anymore, I still hear from clinical colleagues that some of the challenges include, client and practice finances and compassion fatigue. So veterinarians love animals and want to help all of the animals. And we do highly skilled work that would be much more expensive if it were performed on humans. Yet, clients sometimes think we should be able to do the work for free, or else we're being, uncaring and greedy people. But in truth, a veterinary practice can't stay afloat if it takes on all the charity cases that present themselves. So that's hard. That's very hard. And definitely veterinarians, we do understand that pet owners can be in really difficult, heartbreaking situations, and we want to help as much as is feasible. This last slide I'm showing here, these are my pets. So there's Juno in the front and there's Betty on the back. You can see that I'm not the kind of pet owner that successfully keeps animals off of furniture. So I, yeah, I can't claim that. And then I also have an email address here for any follow-up questions.
Okay, so that was really inspiring and really helpful. You have a lot of accomplishments. So I'm curious, I think we touched on this a little bit before, but what originally drew you into the veterinary profession?
That is a great question. So, I find the animal kingdom in general to be fascinating, and I see strong connections between humans and other animals, which is really what attracted my interest. So, I entered the profession because I was interested in finding out what ailed animals and attempting to heal them. And I eventually wanted to go deeper into understanding tissue responses to disease and treatment. And even though I don't get to examine fluffy puppies at work anymore, I'm still constantly learning new things about animals and have a lot of respect for my fellow veterinarians. I think veterinary medicine, veterinarians are smart, compassionate, humble, really interesting group. And I've never regretted becoming a veterinarian.
Okay, thank you for that. What do you think high school and pre-vet students can do in order to prepare to become a veterinarian?
I think there are really two elements to consider. First is try to figure out if you really want to become a vet or if you just like animals. So, try to shadow or assist in at least a few different animal environments, like small animal clinics or emergency hospitals, shelters, mixed and large animal or equine farm calls, zoo and exotic rescue facilities. Unlikely you'll do all of those, but try to check out a few different venues. Read up on other roles for veterinarians as well, like veterinary specialties, government and army roles, public health, lab animal research roles, and feel free to reach out to veterinarians and ask questions so you have a sense of the realities and the opportunities. And being in clubs like this one is helpful for your learning process for sure. The second part is if you've decided you definitely want to become a vet, set yourself up as a strong vet school candidate during your undergraduate years. So, when you apply, your activities as an undergraduate are the ones that really impact your score as an applicant. So, you'll want to have animal and veterinary experiences, which can include anything from animal science courses and labs to shelter or rescue work, shadowing or assisting veterinarians. Having experience with multiple species, not just dogs and cats, is a real plus. Build relationships with a few people who can write your letters of recommendation, such as veterinarians that you've shadowed or faculty members who know you well. And then finally, don't forget to list all of your activities in your application, even those that don't involve animals. Like I mentioned before, if you have a part time job, play sports, do a research project, play an instrument, have a leadership role in any group or organization, definitely mention that. And when you do land an admissions interview, have a few key experiences in mind that you would like your interviewers to know. They could be interesting veterinary cases, or they could be other life experiences that taught you a lot about yourself.
That was very helpful. May I ask, is there anything you wish you knew while you were in vet school about other career paths?
During vet school, I was so certain that I would go into small animal practice that I only put slight effort into learning about alternate career paths. Like I was vaguely aware that a few of my classmates were planning to do non-practice things, like, oh, that's the person going into research or lab animal medicine or something, or the army. I did shadow a lab animal veterinarian and a public health veterinarian and some veterinary pathologists that were at the university and also the Department of Agriculture. Those were rotations and shadowing set up through some of our clinical rotations. So it was kind of part of the curriculum that you could pick these things to do. But I'm not sure I really took off my blinders enough to ask the deep questions or really imagine myself there in these alternate roles. I think that I didn't take enough of an opportunity also to attend many veterinary conferences, or when I did, I only attended the clinical sessions instead of sort of the alternate paths. So I feel like that was a little bit of a miss by me. There generally are some university research days that you can attend. I think I would have focused more on that if I had another chance. I did feel like the veterinary faculty was very welcoming to students, and I think they would have put me in touch with veterinarians on alternate paths if I would have asked for that. So, yeah, I think the opportunities are definitely there.
Thank you so much for chatting with me today and sharing all this helpful information. I wish you continued success in your career.